Well, let's take a closer look at what's going on within our health facilities. The right to dignified healthcare work is the right to dignified healthcare for all. That's the title of a new report by Oxfam and the Young Nurses Indaba trade union. It's found that unfair labor practices and the poor treatment of healthcare workers has compromised the quality of healthcare and also left us with a healthcare system that simply is ill-prepared for pandemics like COVID-19. Now, the report also highlights the deep inequalities in our healthcare system and the resources needed by public health to be able to deal with the wave of cases. Well, to talk to us about their findings, we are joined via Skype by Mthathi, the Executive Director of Oxfam South Africa. And on the line, we have with us Sister Fikile Dikolomela-Lengene, who is Deputy President of the Young Nurses Indaba trade union. Ms. Mthathi, I think I'm going to start with you and get the overall perspective here from Oxfam, what exactly it is you were looking at. In conversations that we've had in South Africa just over the past few days, we've seen many of our public or private hospitals rather struggling to keep up with the workload, having to share that workload with the public sector. Are we seeing enough of that collaboration? I know you've looked at those inequalities and the resources being shared between the two sectors.
Yeah. So the report we launched today together with our allies, Wainitu and others, is explaining the extent and the roots of the brokenness of our healthcare system. As you are saying, we've got a healthcare system that is dichotomized, where on the one hand you have the private healthcare sector, which is predominantly profit-driven, rests parasitically on the shoulders of the public healthcare system. And on the other hand, you've got systematic and chronic underfunding by the government that we have seen, particularly over the last 8 years. And the impact of this is that our right to healthcare access as the public is undermined. And the healthcare workers who are, effectively the kind of the ones who shoulder the healthcare system are being impacted in ways that violate their rights and have made, for many of them, their working conditions untenable.
If I actually bring Sister Fikile Dikolomela-Lengene here in this discussion, we talk about those conditions faced by healthcare workers, many of them female, coming from very vulnerable communities as well. But there seems to be, especially lately, this lack of transparency around the conditions that they face in the workplace and the kind of remuneration that they're getting as well.
Afternoon, I'd like to greet everybody. I think that COVID-19 has actually exposed what the health workers have been crying about. It is for long that especially the nurses have actually been saying, this is too much. The influx of the patients that are coming into our facilities, we cannot handle. The lack of resources that is in the department, especially in the public sector, has actually now become even more worse. You look at Eastern Cape, you are having a province that within 2 months has actually, due to corruption and looting, 1 billion has actually missed in the fiscus of the public purse. And then we also look at nursing. Nursing comprises mostly of what we look in terms of age. More of your age between more or less your 45 and your 55. That is a category that is there in the nursing fraternity currently. Now, when you look at COVID and who it strikes at first, you look at the age are more at the vulnerable. And these are the aged who are at the front line. Let us not even go on to remuneration. Remuneration has always been pathetic, we would actually say. Our nurses have always been undermined because of them being female, because of them doing a job that most people see as a woman work. Take care of people. You are born to take care of each other. What is the cause? Hence, they don't put value into the skill that is out there. And right now, currently, actually, the cracks have actually are showing up.
Yeah, Ms. Mthathi, if I come back to you and I ask you then to crunch the numbers for us, because this isn't just about gender inequality, it was also racial inequality. And then there's the issue of resources allocated to some hospitals versus other hospitals. When we crunch those numbers, where are the gaping holes in terms of budgets especially?
So the biggest gaping hole is between the private and the public sector. So right now, our private healthcare sector caters for only 16.4% of the population. And yet it consumes nearly 50% of the total healthcare expenditure. That is untenable. It can't be sustained. And the private sector is able to do that because it is able to drive profits and has turned what should be a public good into a commodity to be traded. And is, extracting money from, the members, from the public, from this society, and sending the money, as we show in the report, to shareholders. We saw in the last, 4 years between 2016 and 2019, where shareholders were able to receive, through particularly, the dividends and buybacks, 19 billion at a time when our healthcare system and the strain has been rising. And of course, for the government, we a public sector that caters, for more than 80%, and yet, underfunding, has been seen. And of course, the additional issue that Fikile references, of where not only do we have underspending, which has to be addressed, and that's one of the most urgent recommendations we are making, that this is unsustainable.
Yeah.
We've got to break through this, and we've got to sort out the issue of funding of the public system. And then, of course, we've got to sort out the issues at the operational level of how money is spent.
Yeah, well, I'm going to ask for more recommendations then from you, Sister Fikile, because essentially as a health worker and representing some of them as well, you know those frustrations. How do healthcare workers then feel about the prospects of universal healthcare in the country? Are we moving fast enough? What are the other recommendations that you then put on the table?
I would like to believe that looking at how we are actually looking at the pandemic, we are actually failing. This is actually showing us that we are not ready for the NHI with the kind of system that we have, because right now when you look at the emulation of the NHI, we'll be having this one pool of funds, whereby this pool of funds will need to be distributed. Currently, they have actually shown us that they are able to get into the and loot as they have been doing previously. Now, the recommendations moving forward, if we cannot hold those in office to account and responsibility and actually see people going to jail for some of these corruptions, then we should know that we do not have trust of the society, and we do not have trust. As healthcare workers, definitely the trust between us and the government has actually fallen flat, because right now we are actually being put out there to go to war without any resources at the end of the day. Our lives right now, we have to put down our lives to make sure that the system goes forward. Now, it's very clear currently that if we do not see people going into jail currently, especially in the Eastern Cape, then we should forget about the NHI.
The corruption needs to be dealt with first. Sister Fikile, thank you so much for speaking to us. The frustration, very, very clear, coming from our healthcare workers. That was Sister Fikile Dikolomela-Lengene, Deputy President of the Young Nurses Indaba Trade Union, as well as Siphokazi Mthathi, Oxfam, South Africa's Executive Director, speaking to us there in that discussion. Share your thoughts on Twitter. The handle is @ETV News SA. You can send us a WhatsApp voice note as well. That number is 082 777 0735. Our email address is newsroom@etv.co.za. Let's